All right, we are here with Dr. Conrad Gould in New York. Is it New York City technically, or where exactly are you?
I am at this point 100% a New York City resident.
Nice, nice, nice. So you've been there through through thick and thin. So tell us a little bit about some of the misconceptions because people will seem to be pretty muddy on the details in New York, whether Cuomo did a good job, bad job, or some of both. So let's kind of get into that a little bit. What are some of the biggest misconceptions about the response in New York? Why it was hit so hard, and a little bit about that.
So yes, I'm a chiropractor, as you are, working in New York at the moment. And the biggest misconception, in my opinion, is that New York completely butchered this response to COVID-19. There were definitely mistakes. There were definitely big mistakes in terms of the state governance response. But overall, I definitely think they did a good job. Right when everything started, it was, like a bomb went off, pretty much. Nobody really could have done anything to prevent the initial spike of cases. There was no
Right.
way. Impossible. People say, wow, they didn't do enough to prevent this, when I completely disagree. People were flying in from China and from Europe from, late 2019 to early 2020, before there was any banning of travel, which was done by Trump to prevent from China people coming in. But for New York, it was from Europe. So nothing he did prevented any spike in New York, which was one of the first hard hit states.
Yeah,
And
and you were
we had,
saying the other day you work with patients directly who travel abroad, correct?
yes, and especially, yes, I work in Flushing, New York, which is a predominantly Chinese demographic. And many of the people at that point were traveling back and forth for the Chinese New Year. And it was a very high stakes situation. Um, and I was very concerned because I saw these reports coming out of China about the coronavirus. And that was right when things were really heating up. And it was concerning.
Yeah, and that
And
was January, right? When none of us had really even put it on our radar yet.
nobody, yes, it was completely off the radar for
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 what?
everybody. And you know what? And in reality, Trump did stop travel from China um, for the coronavirus, and that was definitely an action he took that was positive. However, the majority of the cases in New York were from Europe, so that's a whole different, you know, area.
Yeah,
And
and I think part of that too. People try to say Trump did that one good thing, and then Democrats were not like against it, and so that's true. That was the negative on them. But then from there, every step of the way, everything we did for our entire response was too little, too late, as far
yeah,
as at the federal level, because we had people said, hey, we needed to do the shutdowns, but we needed to do them in January or February, because they had been, since February, actually, it was since January is when the CDC first recommended it. It was towards the end, though. So basically, let's say February, they were saying we needed to do these shutdowns, and then the whole thing would have just been over. But then, since we waited till March to do anything, then people are saying, well, hey, wait a minute, we did the shutdowns. Now, why isn't it over? Because we did it. It was too little, too late. Plus, some states weren't doing it, and then you can't have all the states do it. Some not. You have like half the states do it, half don't, and then people are traveling between states. So what does it matter? You're just going to go infect everybody. Now people are at the point where they're like, hey, why do we have to wear masks? We did the shutdowns like you said. Why aren't we over this yet? Because every step of the way, we're doing too little, too late.
exactly right. And in fact, with New York, it was basically inevitable that New York was going to be the hardest hit state. There was no way around it. everybody was coming in here before this was even mainstream on CNN or any network. It was people were traveling into New York from China, from Europe. That was already happening. It was the damage was already done before any action was taken into place.
And people
And
might also not be putting into context, your wife, you were talking about how she travels to work. How is that different from the way people travel to work in more rural states, say like Texas or Arizona, where they're getting cases now, but where they didn't spike early on?
so, yeah, my wife, when she was traveling before, before everything shut down, it was by train and by subway or bus. And those are closed quarters where you're with people who may or may not know what's going on in society. And they could be spreading germs. And it was, just a free for all in terms of the virus. And, it was just a bad case to have people running around and doing work in that type of situation, especially knowing what we know now of how contagious the virus is. That was like probably the worst case scenario.
And so you basically you have an island with 9 million people, and they all travel around by tin cans on a track.
Yeah.
And so basically, if you couldn't really set up a better scenario for spreading a disease, right? Like if you were to try to engineer something to be better at spreading a disease, you'd probably have a hard time doing
No,
it.
you couldn't. That was the worst case scenario. And it hit New York first. So imagine, the most contagious thing imaginable hitting an area where people live in close quarters and travel in very tight areas. It's going to explode. And that's what happened. It exploded and many people died, including, my patient, like people I work with and, were very vulnerable to the disease, and a lot of them died. It was very, very sad. I went to Florida for a few months when everything was going down because I could tell that things were really heating up and I wanted to get out of the area. And when I came back, it was like, when essentially to a degree, the dust had settled. A lot of my patients really, they didn't make it. It was pretty wild. It was a wild experience where I usually at these facilities, what happens is I give the administrator a list of the people that I see, and she went through the list and was just checking them off as people who had died. It was a very crazy, surreal experience, and I'm happy that we're on the other side of everything at this point, for sure.
Yeah, well, and we hope that we're on the other side. The scary thing is with so many states now having explosions of cases, just crazy exponential growth in Arizona, Texas. Someone could travel theoretically to New York and just start spreading. Like people could do that. Like if we don't keep this under control, there's nothing stopping it necessarily from re-spreading through people. Unless you're assuming we have herd immunity, which we don't necessarily know that.
Yeah, so pretty much Cuomo has initiated a order where if you have been traveling from a high-risk state, that you have to explain that to the authorities as you're crossing a border or as you're going through an airline, which is good. That's a good thing. And if you don't do that, if you don't explain where you're coming from or where you're staying, you get fined. And, people are saying that is a breach of rights and things like that. Well, that was happening to New York when everything was going down. People weren't allowing New Yorkers to go into certain states, and we're finding them. And it's pretty much the same exact thing that's happening now, just in reverse, because New York is now doing better. And now we want to prevent the spread from going crazy again. So,
yeah, it's wild. We do have a constitutional right of ingress and egress, basically to and from countries or to and from states. But, people are so worried about our rights being taken away, but it's like we're in the middle of a pandemic. We're just trying to get that under control. What people are concerned about is they say, hey, you give them that control once, and they're never going to give it back. And so I think a big problem is we've lost trust in institutions, which is why people are bucking the system on, not wanting to wear a mask. I have a friend who doesn't want to wear seatbelts because he doesn't want to be, following a seatbelt law. He thinks it's unconstitutional, so he doesn't wear a seatbelt. That's just how some people are. But now I think that mentality is kind of spreading.
Yeah. In New York, pretty much everybody in public is wearing a mask. They're very diligent about that. And I think there's a separation that needs to be made between also the governance and the way that just New York is reacting as well as the state in terms of, everybody doing their part in wearing a mask and things like that. Is it pretty, is it in North Carolina, are people wearing masks? Is it pretty much everywhere you go, or is it pretty?
It's gotten better, but people are still bucking the system, and you'll see people working in a place where the sign says you have to wear a mask, and then the workers aren't even wearing a mask, and you see people walking around not wearing it. So it's like, it's kind of hit or miss.
Yeah, to a degree. I've seen that here too. It's really, I have seen that, although New York is pretty good with it in terms of everybody wearing masks in the public. I have seen that exact same thing. So I totally relate to that type of thing where in the workplace, sometimes people aren't wearing masks and not doing what they're supposed to do. And it's a problem.
Yeah, and I think that living in an area like you are, people just kind of understand it. If you're on, Fox News, MSNBC, CNN, constantly for months on end, it's like you kind of realize, like, this might actually be dangerous.
Yeah, exactly right.
All right. Well, if you're on YouTube, go ahead and put some comments below and put some questions. So if I have Dr. Gould on again, maybe he could answer some of those. And even on Facebook, if you put some questions in the comments, he's in the group there too. So let's keep the conversation going, and I will see you guys in the next video.